Welcome to Nurse Practitioner Week. The presenter for this session is Elena Prendergast, DNP, APRN, and Family Nurse Practitioner. Dr. Prendergast is a graduate of the Family Nurse Practitioner Program, Master of Science in Nursing Program at Frontier Nursing University, and in 2017, she completed the DNP program here. Dr. Prendergast has been a nurse since 2008. Her clinical experiences include primary care, medical, surgical, and interventional radiology, critical care, and hospice. She began her career as a nurse practitioner at an integrative physical medicine clinic in Augusta, Georgia. A passionate advocate of palliative and end-of-life care, she has completed both the trainer and advanced practice end-of-life nursing education consortium courses. She was recently hired as Clinical Director of Palliative Care at Doctors Hospital of Augusta and is responsible for starting a palliative consult service at their facility, where she is focused on improving quality of life for patients diagnosed with serious or life-limiting illnesses. Her long-term goal is to work to develop palliative care curricula to equip advanced practice nurses to effectively support, educate, and empower patients to take an active role in their healthcare decisions.
Thank you for attending this presentation entitled Delivering Hope, the Role of Education in Preparing Advanced Practice Registered Nurses in Palliative and End-of-Life Care. My name is Dr. Elena Prendergast. The similarities between birth and death are striking. There is a sacredness in being in the presence of someone taking their first and last breath. Advocates for both insist they are natural processes and contend that they're called to deliver hope, empower patients while avoiding distress. However, rather than embracing this concept, palliative and end-of-life care has been stigmatized in the United States and is most evident in the training of healthcare providers. Contrary to present-day thinking that palliative care is a new specialty, nursing has its roots in palliative care. The very foundation and heart of nursing was founded on caring for the dying. Florence Nightingale and Clara Barton were known for the care and compassion they provided to wounded and dying soldiers. The modern hospice movement was established in England by Dame Cicely Saunders, who trained as a nurse, social worker, and physician. Hospice nursing expanded from England to the United States when Saunders came to teach at Yale University. As a result, Florence Wald developed a curriculum for hospice nursing. Today, nurses continue to serve as pioneers to advancing palliative care. Betty Farrell and Nessa Coyle are two doctorally prepared nurses who have been on the forefront of research, education, advocacy, and clinical leadership. Care of the dying was transformed in 1982 with the enactment of the Medicare Hospice Benefit, which offered services to individuals with terminal illnesses. In 1995, the study to understand prognosis and preferences for outcomes and risk of treatment support found that our healthcare system failed to honor patients' wishes. As a result of the support study, as well as several reports about dying, palliative care began to grow, and the role of APRNs became more essential. There are approximately 90 million Americans living with chronic illness in the U.S., and that number is expected to double over the next 25 years. In 2015, the Center for Disease Control reported 2.7 million deaths in the U.S. Of those, 72.6% were attributed to chronic illness, which includes heart disease, cancer, chronic respiratory disease, renal, stroke, Alzheimer's, and diabetes. In 2015, healthcare expenditures were estimated to be $2.7 trillion annually, and of that, 86% was spent on chronic diseases. These chronic diseases account for untold pain and suffering. So what are our problems? There currently exists a gap between the number of providers with palliative care training and the number required to meet the need of the expanding population of seriously ill patients. National estimates indicate that 6 million persons could benefit from this evidence-based care model. In response to the growing number of Americans living with serious, complex, and chronic illnesses, palliative care services in hospitals have increased to 78% since 2009. Estimates project that there is a shortage of between 6,000 to 8,000 providers trained to address this current need. According to the ANA, there are currently over 3.6 million registered nurses in the U.S. Of those, 234,000 are advanced practice registered nurses. Unfortunately, less than 5%, 0.5%, are certified in hospice and palliative care. Nurses are responsible for caring for our nation's sickest population, yet they often lack the necessary training to handle the complexities of chronic illnesses. The World Health Organization indicates lack of awareness in training palliative care is a barrier to quality care. Education in palliative care is needed for all providers in 3 levels: basic, intermediate, and specialist. Unfortunately, medical and nursing schools only spend approximately 15 hours on end-of-life education. One study found that only 2% of textbooks contained end-of-life content. Often it was inaccurate and only focused on hospice, not palliative care. Didactic and clinical education is also lacking, with only 17 master's, hospice, and palliative care programs across the whole U.S., and 8 APRN residencies or fellowships to 106 physician residency and fellowships. What is a solution? Palliative care focuses on relieving pain and suffering while improving communication and supporting informed decision-making for patients and their families. It is provided to patients regardless of treatment decisions or prognosis. The benefits of palliative care include enhanced quality of life for patients, higher satisfaction scores, longer patient survival times, reduced hospital expenditures, and lengths of stay. Education is key to improving access to quality palliative care. It's important to note that as transformational documents such as the Institute of Medicine Dying in America and the formation of the consensus model for APRNs have been released, the role of advanced practice nursing in palliative and end-of-life care has evolved, and standards have been developed to ensure quality evidence-based care is delivered. According to the American Nursing Association and the Hospice and Palliative Nursing Association, palliative nursing is a holistic philosophy of care that focuses on patients facing serious or life-limiting illnesses. This care is delivered across a variety of settings, which include acute, primary, and homes. Palliative nursing is a vital component across the lifespan, from perinatal to geriatric populations. According to the World Health Organization, palliative care is a human rights issue, which most affects those from underserved populations. The Hospice and Palliative Nursing Association states that all nurses are trained to provide basic palliative care, which includes the management of chronic illness, symptoms, and communication. However, the specialist palliative care APRN displays expertise beyond the primary nursing role. It is here that the advanced education and skills are crucial. In today's quality-focused healthcare environment, it's important to be guided by evidence-based clinical practice guidelines. 2 such documents are the Foundation for Quality Palliative Care, or the National Consensus Project for Quality Palliative Care Clinical Practice Guidelines for Quality Palliative Care, and the National Quality Formula, a national framework and preferred practices for palliative and hospice care quality. A consensus statement. These documents serve as the guiding principles for ensuring the delivery of consistent care by those who are functioning as specialists in palliative care. In other words, they're the Bible of palliative care. Unfortunately, the shortage of graduate-level palliative care training has left many APRNs seeking ways to obtain education and experience necessary to function as specialists in palliative care. It's the responsibility of all APRNs to seek out resources for professional development. Listed above are some of the references that will help ensure consistency and quality in palliative nursing. Some of the textbooks are the Oxford Textbook of Palliative Nursing, Advanced Practice, Palliative Nursing, which is the only textbook dedicated to APRN role in palliative nursing. The ELNEC, which is the End of Life Nursing Education Consortium. Also getting certification from the Hospice and Palliative Nursing Association, as well as being involved in research with the NINR and joining professional organizations such as the Hospice and Palliative Nursing Association. How can we answer the call? Through education, leadership, and advocacy. As educators, we need to inform and dispel myths. The Institute of Medicine has stated that there's a need for better understanding in the role of palliative care among both the public and professionals across the continuum of care. There is an erroneous belief that palliative care hinders hope, poses ethical dilemmas, or rations care. It's important to note that palliative care may be offered simultaneously with life-prolonging or curative treatments, and it includes hospice only when appropriate. Recently, 78% of those surveyed indicated that they did not know the definition of palliative care. We can inform patients, families, and other health professionals about the benefits of palliative care and the available services and supports which will improve outcomes and transform how we care for patients. As advocates, we need to stay abreast of legislation such as PACHETA, which is the Palliative Care Hospice Education Training Act that went before the Congress this year, which would direct the implementation of a national education awareness campaign so that patients, families, and other healthcare professionals better understand the role of palliative care. It's important that we get involved in curriculum development in order to increase the substance of palliative care content in both our undergraduate and graduate universities. Personally, how am I delivering hope? Is the investment in advanced nursing education worth it? For me, I have no doubt it is. After working in both critical care and hospice, I realized we were failing our patients. Often in the ICU, we do too much and we refer to hospice too late. I knew there had to be a way to bridge the gap. I advocated for change, and I was informed that I lacked the qualifications to influence how we deliver care to patients with serious and life-limiting illnesses. So in 2011, I embarked on a mission to bring much-needed specialty into my area. As you can see, the road has been long, but my education is already opening up doors and providing me a platform to effect change. I became an ELNEC trainer, and then as I was in the master's program, I took the ELNEC APRN. I certified as a family nurse practitioner in 2016 and just completed my doctorate this past June. And I was hired to start an NP-led palliative consult service at the facility where I previously worked. In 2018, I anticipate board certification in palliative care, and I've been asked to be a guest lecturer in our local ONS, and I will be putting on their education symposium, which will be focused on palliative care. As we ponder this quote by Dame Cicely Saunders, who was the hospice pioneer, palliative care providers usually recognize that most people are not afraid of dying as they are being abandoned. The worst thing we can do is abandon someone who is hurting. Attitudes which promote death rather than affirm life are the ultimate abandonment. I often wondered in the beginning of my journey why I ended up at Frontier Nursing University, what most consider the hallowed ground of midwifery. One day while on campus, I became engaged in a conversation with a midwifery student who told me she could never see herself doing what I do because it seemed to take away a patient's hope. It was then that I discovered why the mission of Frontier was so in line with mine. You see, I now understand. I share the same goals with my midwifery colleagues to provide evidence-based, cost-effective, quality care to my patients. My journey parallels theirs. The diagnosis, like a pregnancy confirmation, is the beginning. Their illness, like a pregnancy term, requires my clinical management skills. But in the end, it's my presence that's most appreciated. My passion is to serve as an advocate, educator, and guide, to allow a natural process to occur naturally, to alleviate suffering, to avoid distress, and to allow my patients to have a voice. In the end, I know that every day I blaze a new trail, that I'm answering the call. I'm delivering hope to my patients and their families. And I'm very proud to be a nurse practitioner answering the call. Thank you for coming to our presentation. These are my references.